You've no doubt probably seen the comments on social media questioning the accuracy of the state counts for new COVID-19 cases.
Dr. McGeorge took those concerns directly to the Michigan Department of Health and Human Services to find out why the numbers can appear to be so confusing. Frank?
Yeah, Kim and Devin, cases, of course, are reported every day. Initially, those test results are sent to the state disease surveillance system by the lab that performs the test. Once that data is tabulated by the computer, any remaining discrepancies are actually reviewed and resolved manually by the staff. That process includes specific protocols to handle people who have had more than one test or who live in a different county than the one they are tested in.
The Michigan Disease Surveillance System is a person-centric system. So if Jim Collins is in the system with a COVID infection, confirmed COVID infection from a previous laboratory, if there's another laboratory that comes in positive, the system doesn't create a new case, it just marries the additional laboratory information to the existing case.
That means multiple tests on the same person only get counted as one case, according to Jim Collins, the director of the Communicable Diseases Division.
Staff from my division every morning are up first thing looking at the laboratories before we report out to make sure that cases that the system thinks might be the same but can't say it with 100% confidence are evaluated by human eyes.
Steps are also taken to ensure the case is attributed to the correct county.
Our testing is based on the residence of the person. There is an occasion where we don't get an address for the person. And so initially that referral goes to the county where the testing took place. So we don't lose referrals. In the process of following up, the case is identified, is given an address. And if it's in another county, that case then moves to the other county.
As for numbers typically being lower on Mondays,
national reference laboratories that are running thousands and thousands and thousands of tests in single laboratories every day change their resource levels on the weekends, holidays. And I think that also there is a variance in the number of people seeking care and the number of tests being administered.
Now, finally, I want to mention the difference when you look at the daily reported cases compared to the state graph of cases that actually shows them by date of onset. The reason that the state recompiles the information by date of symptom onset compared to when the test returned positive is actually because it does give a more accurate picture of when the actual infections are occurring.
Been a lot, Frank, there have also been a lot of questions about what counts as a COVID death. For example, if someone with cancer dies but also tests positive for the virus. A lot of confusion about that.
Well, that's another area that I really wanted more detail on, too, and we did get it. Coming up at 6, I'm going to explain exactly how they're determining deaths and what that means for the numbers.
Had so many questions about that, so we'll see you again at 6 o'clock for more on that.